Hormone therapy for postmenopausal women. Definition: hormone therapy is very effective in the management of postmenopausal women with symptoms, with a large number of patients being treated with HT, especially the combination of estrogen and progestin therapy. In the WHI study, clinicians now recognize the potential adverse effects of EPT. Also, this concept is much clearer now. Some women may still benefit from short-term HT, especially for young postmenopausal women.
Hormone therapy is a therapy that women who are postmenopausal with hot flushes, night sweats, or elevated risk of bone loss can take to replace what their ovaries used to make. When women go through menopause, about 75% will have some hot flushes, maybe mild, maybe not too bothersome. About 25% of women will have really severe, incapacitating hot flushes that stop them in their tracks, soak their beds at night, and those women need help. They need some type of medical therapy, and hormone therapy is the gold standard. It's the one that really works. It relieves hot flushes, it improves sleep, fewer sleep disruptions, better dream sleep, and it also prevents bone loss and some of the vaginal symptoms that women have. It also has a few other benefits. There's fewer cases of diabetes and less heart disease, but only in women who start it when they're under age 60 or close to menopause within 10 years.
Applications in medicine. The use of oral estrogen and progesterone as HT has been reported for the following conditions: treatment of vasomotor symptoms associated with menopause, prevention of cardiovascular events, treatment of vaginal and vulvar atrophy, prevention of postmenopausal osteoporosis.
When the Women's Health Initiative study came out 15 years ago, the study found that women on hormone replacement therapy, or HRT, faced a higher risk of cardiovascular disease and breast cancer. Women on HRT to control hot flashes and other menopausal symptoms rushed to their doctors looking for other options. But the recently released ELITE study found that HRT can actually be good for your heart if it's given at the right time.
Earlier is better. You want to start that hormone therapy when you're beginning to have hot flashes, when you're starting to skip periods, and within that first 10 years of having completed your menstrual cycles. Waiting until you're in your 60s is too late.
The ELITE study also found side effects can be lessened by delivering the estrogen directly through the vagina or the skin, not with pills which are metabolized in the liver. Still, HRT is not for everyone.
An ideal patient for hormone replacement therapy would be someone who is suffering right now with hot flashes. Also, women who are at an increased risk of osteopenia or osteoporosis, which is thinning of the bones or bone loss.
Pros and cons. Pros. HT can be beneficial, according to the ACOG, by helping with vaginal dryness, protecting to bone loss that can lead to hip and spine fractures, reducing the risk of colon cancer, revealing hot flashes, especially at night. Cons. There are also risks to HT, according to the ACOG. Some risks include breast cancer, deep vein thrombosis, gallbladder, heart attack, stroke, uterine lining wound, which can increase the risk of uterine cancer.
Okay, so let's talk about the cons first, which is what everyone really is concerned about. First of all, there's an increased risk of heart disease. And for every 10,000 women taking HRT over a 1-year period, only 5 extra heart disease diagnoses were made in women in their 50s. So only 5 out of 10,000. But 19 extra cases among women in their 70s. So there's a huge distinction depending on the age group, as you can see. The second risk was breast cancer. Now, in comparison to heart disease, for every 10,000 women on HRT for 1 year, there were 9 extra breast cancer cases total. Now, HRT increased the risk progressively to about 24% overall, even after stopping HRT for some reason. If you opt for HRT, make sure that you remain up to date on your breast cancer screenings. There was also an increased risk of stroke, and for every 10K women on HRT, there are 9 extra cases. Blood clots in the lungs. There were 3 extra cases found. And there was increased risk of gallbladder disease and urinary incontinence by about 50 to 60% for both. All right, so now let's talk about the pros. First of all, besides the benefits of HRT this study has found, keep in mind that one of the greatest pros of HRT is that it's hands down the most effective treatment for hot flashes, although not the only option, certainly. Also, it decreases the risk of hip fractures and 6 fewer cases for every 10,000 women that were treated for 1 year. There's decreased risk of colon cancer. There was only about 0.5 fewer cases, but those who did develop colon cancer, it was discovered at a more advanced stage in the study. And lastly, it decreases the risk of diabetes, interestingly. There were 16 to 21 fewer cases per 10,000 women. All right.
Issues apply in Ecuador. The frequency of menopausal symptoms in this population of Ecuadorian women was similar to that found in other populations of Latin American women and from other regions, and was associated with age and hormonal and metabolic status. A significant association between abdominal obesity and the presence of menopausal symptoms was observed. Change in lifestyle and eating habits should be recommended, since they are effective and simple measures to improve quality of life and reduce cardiovascular risk in postmenopausal women. Conclusion: hormonal therapy is highly effective for the management of vasomotor symptoms in postmenopausal women. Vaginal estrogen is used for genitourinary symptoms only. Hormone therapy is not recommended for primary or secondary prevention of coronary heart disease or dementia. Several non-hormonal therapies are also effective for the vasomotor symptoms.